Right. If I look at the current landscape for patients with advanced prostate cancer and try to summarize that, basically we have AR targeting that works with androgen deprivation therapy, abiraterone, enzalutamide, apalutamide, etc. Fine. We also have taxanes, docetaxel, cabazitaxel, and we have bone targeting agents with radium-223 and denosumab zolinic acid. Okay, this is pretty much the landscape. So what is most promising in terms of new strategies? One thing is obviously immunotherapy. We know immunotherapy works at the individual level. In some men, it's quite magic, to be honest, with some long survivors, etc. But those are really a minority. So one axis for research is to try to better identify who they are. The second is to try to boost efficacy of immunotherapy by combination of selecting various subgroups. This is one axis. Another axis is really to try to better target the disease based on its own characteristics. For example, we now realize that a minority of men have DNA repair defects. Some either in germline problems or mutations, deletions, etc., perhaps 5 to 10%, or in the cancer itself, somatic lesions. So we're now trying to target these cancers using PARP inhibitors, or also using platinum, such as carboplatin. So this is obviously a very important second axis for research, and again we know, at least at the individual level, that it can work. Now we need to demonstrate it properly. There are actually other targets potentially. PSMA is really appearing as a potentially very important target in this disease. It's expressed in most cancers in the advanced stages, perhaps 80% of cases. And you can target that either by linking to PSMA a radioisotope such as lutetium or actinium, and you will irradiate the cells doing that. This is something that was shown to be active some months ago, and there is intense research around that. Or using other strategies to really target the PSMA without radioactivities. And again, this is a very important field for the research. One question one advantage also is that you can select patients based on imaging thanks to PET scanning using PSMA as a target. So those are, two or three potential very exciting fields for research. Also, some other classical things are maintaining pressure against the androgen receptor with perhaps new drugs, better targeting the androgen receptor, maybe the end-term part of a receptor, or combining various strategies around the androgen receptor axis. So lots of studies are currently ongoing. Hopefully they will show great results in the near future.